I do. And if there's one thing that a person expecting a child researches before labor and delivery, I would urge it to be fetal monitoring. So fetal monitoring was introduced in the 1970s as a marketing push. There was no clinical trial, there was no studies to say, hey, we see that this can be a benefit and we would like you to implement it in a hospital setting. Now, in fact, studies since the introduction of fetal monitoring have shown that it does not improve birth outcomes for mom or baby. But since its introduction, C-sections have rose from about 5% of all births to over 30%. So I think they are connected, but one of the most common reasons for emergency C-section, at least in America, are non-reassuring fetal heart tones, right? So mom is laying down, she's hooked up to monitors, doctor comes in and says, oh, your baby's heart rate is dropping, we need to do emergency C-section. So the World Health Organization estimates about 5 to 10% of all births will need a C-section. No doubt about it, C-section is necessary to save the life of mom, baby, or both. But in the United States, the C-section rate is over 30%. So 1 in 3 of those births are not emergencies. And again, most common reason for a C-section is non-reassuring fetal heart tones. Furthermore, studies have shown that if mom is able to labor upright, in an upright position, if she's able to birth in an upright position, her chance of baby having non-reassuring fetal heart tones drops 54%. Your baby is more likely to get oxygen to tolerate labor and delivery in an upright position. But with fetal monitoring, most times, not all, but most times you are strapped up and you are laying in a bed and you can't really move that much. I want to backtrack really quick to the seizures, right? That study. Follow-up studies have shown that we need to perform 61 unnecessary C-sections to prevent 1 neonatal seizure. So if we know all of this, why do doctors and hospitals implement it, right? They should look at the studies and show that, hey, this can actually increase unnecessary C-sections, increase risk for mom and baby if we do fetal monitoring, and it should be on a case-by-case basis. So why don't they do that, right? About 90%, I think, of all births have continuous fetal monitoring. The answer, 100% liability. Hospitals, policies, they say that, we need to do continuous fetal monitoring to prevent lawsuits, right? We don't want baby to come out, not have proper oxygen, have cerebral palsy. We want to protect ourselves. Which is interestingly enough because apparently it has only increased the risk of lawsuits by using this. So all in all, based on evidence, benefits versus risks, I think that we are doing things totally backwards in America. And that is my problem with fetal monitoring.